everyone. My name is Nirmala. I'm one of the general practitioners working in Australia. COVID-19 is not a normal flu. It can be severe and fatal. But 80% of affected patients only have a mild disease. They don't need any intervention to get better. Only few develop a pneumonia and multi-organ failure. The symptoms are fever more than 38 degrees, history of fever like night sweats and chills, a dry cough, a sore throat, fatigue, shortness of breath later. If you are sick and if you think you got COVID-19, you can check your symptoms using Health Direct's Coronavirus Symptom Checker. It's an app. Complications can be severe pneumonia, shock stage, multi-organ failure, and even death. In Australia, following people are categorized as suspected cases and will be offered a COVID-19 test. The first is very high risk category. Under this category, close contact in the 14 days prior to illness onset with a confirmed COVID-19 case, international travel in the 14 days prior to illness onset, interstate travel in the 14 days prior to illness onset, and cruise ship passengers and crew who have traveled in the 14 days prior to the illness onset. The second is moderate risk category who will be offered the test. They are healthcare workers, aged and residential care workers who got symptoms. The third is the hospitalized patients with community-acquired pneumonia without a known cause. Here I will touch base what the close contact is. It's a person who spent greater than 15 minutes face-to-face contact with a confirmed case, or sharing of a close space with a confirmed case more than 2 hours. This can be travel in an airplane or a car, or living in the same household. Direct contact with body fluids without recommended PPE, or even aircraft passengers who were seated in the same row as the case, and in the 2 rows in front and 2 rows behind a confirmed COVID-19 case. Now I like to highlight the preventative strategies. Everyone must practice good hygiene. When you practice good hygiene, you should cover your cough and sneeze with your elbow, like that, or even a tissue. Put the used tissues straight into the bin. Wash your hands often with soap and water, including before and after eating and after going to the toilet, preferably for 20 seconds, as soap can kill the virus. Use alcohol-based hand sanitizers, as alcohol can kill the virus too. Avoid touching your ears, nose and the eyes. Try to have a shower and wash your clothes straight after work and straight after shops. Clean and disinfect frequently used items like desks and doorknobs and with alcohol spray. And clean and disinfect frequently used items like mobile phones, keys, wallets, work passes with alcohol spray. And increase the amount of fresh air available by opening the windows and adjusting the air conditioner. The next is, the most important aspect is social distancing. That is, staying away from each other 1.5 meters whenever possible. This can be installed in 4 different levels. The first is in public. So social distancing in public means people should stay home unless it's absolutely necessary to go out. You should keep 1.5 meters away from each other and avoid physical greetings such as handshaking, hugs and kisses. Use tap and pay instead of cash. Social distancing around household, that is stay home again unless it's absolutely necessary to go out. Keep visitors to a minimum. Reduce the visits to the shops, buy things online. If someone in your household is sick, you should care for the sick person in a single room if possible. Keep the number of carers minimum to 1 or 2. Keep the door of the sick person's room closed. If possible, keep a window open. Wear a surgical mask when you are in the same room as the sick person, and the sick person should always wear a mask. Protect other family members, vulnerable people like more than 65, by keeping them away from the sick person. Social distancing at work. If you can work from home, that's really good. If you can't work from home and if you are sick, be honest. Do not go to work. Stop shaking hands to greet others, and hold meetings via video conferencing or phone calls. Eat lunch at your desk or outside rather than in the lunchroom, and limit the food handling and sharing of food with others. So social distancing in schools. If your child is sick, they must not go to school or childcare. You must keep them home and away from others. Avoid queues, cancel school assemblies, conduct lessons outside wherever possible, and have a regular hand washing schedule. Consider more ventilation. Promote strict hygiene among food preparation staff like canteen staff. In a nutshell, we need to learn to live differently. If you don't have a thermometer, buy one. It's handy to keep one at home to check your temperature, just in case if you get sick. If you get a cold or fever, call your GP and make an appointment as usual, but do not appear in the GP's office. Your GP will get back to you over the phone and will give you necessary advices. This is called a telehealth consult. This will really help to stop the spread of the virus and keep the doctors and patients safe during the pandemic. We are really lucky that Australian government, together with the Royal College of Australian General Practitioners, has extended these telehealth consultations to all the people in Australia from 30th of March. This will include general practitioners, other specialists, allied health professional consultations. But we will still continue to see patients face to face if it's necessary. Also, if you fall into the high-risk categories, try to minimize going into crowds. These people are people aged over 70, Aboriginal people aged over 50, people with chronic health conditions like cancer, immunocompromised states like cancer, diabetes, asthma, heart disease, and people who are pregnant. If you are stressed and overwhelmed in this difficult time, please find the Beyond the Blue website. You will find them really important advices for your mental health. At last, I would recommend the annual influenza vaccination for the upcoming flu season. It will stop you from getting influenza A and B. Sometimes, if you get influenza and COVID-19, that can make people really sick.